us today. We're about to get started. I want to welcome Dr. Danny Avula, the Director of the Richmond City Health District, to get us started.
Good morning, friends. My name is Danny Avula. I am Public Health Director for the City of Richmond, and at this time every year, we always ramp up our efforts to encourage people to get their flu shots. The reason being that the flu is still one of the major contributors to hospitalization and death throughout our country. And so this year we're doing something a little bit different. You know, I think the flu shot is a really powerful thing for a couple of reasons. Not only do we know that it is the most effective way to protect yourself against the flu, but it's also the most effective way to protect your community against the flu. And so that's why it's so important to us in public health. And this year we have community leaders who are really helping us practice what we preach by getting their flu shot here with you all today. And a man who really needs no introduction to the city of Richmond, but has been a tireless advocate for health and wellness and prevention, will be leading us off, Mayor Levar, Stoney. Thank you for being here.
Thank you, thank you. Well, I've never seen so many people gather just for me to take a shot. But as Dr. Avula said, and also welcome to Dr. Levine as well, good to be with you as well. I want to practice what we preach. And in order to protect the entire community, that means that leaders have to step forward and actually demonstrate what we want to see from all of us throughout our city and throughout our neighborhoods as well. So I will be the first. Please use me as I take a shot today, but I really want to actually state to the public that how important it is that we all not only look out for ourselves, but look out for others as well. Despite, even though if you do get a shot, I still ask that you still wash your hands as well after here's the thing, right? Am I wrong?
Absolutely.
Am I wrong, Dr. Avula? Still wash your hands. This is not going to protect you, always like, 1,000%. So wash your hands still practice those sort of, those hygiene techniques I think we want to see in everyone. I shake a lot of hands every single day. I kiss a lot of babies every single day. So I know the value of washing my hands, but also taking this shot as well is going to matter as we get into the flu season in the fall and the winter. And so this is how important and significant it can be for our community. So hopefully I will not be the only one. I know Dr. Avula, Dr. Levine, you guys will join as well, but others in our city, let's have the highest shot rate we've had in a very, very, very long time. That's what my hope for this coming flu season. So thank you so much.
All right.
Good morning. Thank you, Dr. Avula, for your hospitality. Mayor Stoney, thank you for being here. I was just thinking that maybe we should say, take a flu shot for your community. And I think it's really important to me as the State Health Commissioner. We've been working on something called the Virginia Plan for Wellbeing, which I consider an action framework for all of us to better align our efforts. If you've seen the plan, it's not a VDH plan, it's really a Virginia plan. It starts with a healthy, connected community as the foundation. And I think for people who take a flu shot for their community, they're certainly doing it for themselves and their families, but they're doing it for their friends, if they're a healthcare worker, for their patients, thank you healthcare workers, and for everybody else. And since you're kissing babies and shaking lots of hands, you absolutely need a flu shot. And as you said, Mayor Stoney, it's one of many tools in terms of fighting disease. So it's not perfect, but it's the best that we can do now. And we really encourage everybody 6 months or older to take a flu shot. And you need it every year because our immunity doesn't last. And the flu viruses are really clever. They change every year too. So the vaccine changes in an attempt to try to protect us. It's really important to spread the word. Our vaccination rates are not as high as they could be. And it is preventable, as Dr. Avula said. It is a major cause of hospitalization and what we call morbidity. When people are sick, it keeps them from going to work, it keeps them from taking care of their family. So thank you for the leaders being here today. I'm happy to take a flu shot for the community with you. And thank you for our partners who will speak now.
Good morning, everybody.
Good morning.
I appreciate the reminder about getting the annual flu vaccine. I do it every year. This is a little earlier than usual and more public than usual. It is good practice, not just to be a good community member, but as a good healthcare provider. And on behalf of the hospitals and health systems We appreciate being here. We appreciate the message around practicing good flu vaccine behavior. Hospitals collectively in the state are about 89% of their employees are vaccinated, where the goal in the Healthy Virginia goal is 2020, or 90% by 2020. We hope to get there sooner than that. It reminds me of, we're in a season where we're reminded about the importance of preparedness for all sorts of events, and our thoughts go out to our colleagues in Florida, throughout Florida, from north to south and southeast Texas as well. And there's a lot that the systems have done to prepare for events like that, and we've seen, I think, the good results from that, and hopefully speedy recovery for all people. But this is a routine annual thing that we need to do to prepare for something a lot of people forget about. Flu is a significant cause of morbidity and unfortunately mortality as well. As large employers, hospitals need to have healthy workers to take care of people during the flu season, so it's especially important for healthcare workers to be fully vaccinated, and we fully support that policy. Appreciate the good reminder from the advisory committee, and we look forward to getting to that goal sooner rather than later. And with that, I'd like to turn it over to our good partners on quality and safety from the BHQC QI, Thelma Baker.
Good morning. Again, I'm Thelma Baker. I'm the Chief Operating Officer at Health Quality Innovators. We are the quality improvement organization for Virginia and Maryland. So we are the organization that works with our Medicare population, working with our healthcare providers to make sure that the quality of care and the health of our Medicare beneficiaries are at its best at all times. And one of the things that we do is to work with our providers to make sure that our patients are protected from harm. And of course, as we are talking about this morning, one of the best ways to do that is to make sure that not only our patients, but our healthcare workers get their flu shots. So one of the things that we want to remind folks of is how important it is, no matter what environment that we're working in, is that the healthcare workers get their flu shots. As we work with the hospitals and the nursing homes and our physician practices, we know that patients who are susceptible to the flu are more likely to end up in the hospital as a result of complications from the flu. And one of the ways to prevent that is not only for our patients to have the shot, but for those that are caring for them to get the shot as well. One of the statistics from last year's flu season is that for our patients that are 65 and older, about 60% of the hospitalizations for the patients in that age category were the result of complications from the flu. So if there's anything else that can be said this morning, it is that we look for everyone that comes in contact with our patients, especially our older population, those folks that reside in our nursing homes, or those patients that suffer from chronic diseases such as diabetes, such as heart disease, that those people that are caring for them, please take the time to get the flu vaccine. Do it for yourself, do it for your patients, and as has been said so many times this morning, do it for the community. Thank you.